Okay. Okay, so let me see. So let's see, we're working here. So welcome back to Better Health Coverage here at HIMSS10. Mike Savella here. We have Joe Diorio from Tannenberg. So thank you for the time today.
Well, thank you, Mike. Thanks for allowing me to join you both today. It's a pleasure to be here, and it's an exciting HIMSS conference 010.
Yes, yes. So for people who are not familiar with Tannenberg, how would you describe what you guys are all about?
Well, we at Tandberg are a real-time video conferencing manufacturer. We provide the video conferencing encoders and decoders, as well as the network products that allow real-time interaction and video conferencing to take place throughout the business of healthcare.
Okay, okay. And I see in some of the press releases here, you've had some examples of how you've used the technology. Can you talk a little bit about that?
Sure. Well, we see interactive technology and video conferencing in particular bringing a critical aspect to the reinventing and the delivery of healthcare. We see streamlining of services and being able to bridge distance, time and distance through video conferencing and bringing that right talent to the right place at the right time to help assist in critical care of patients, to help bring in that expert, to help guide and assist treatment protocols in a very time-effective and efficient manner.
Mm-hmm. So I'm a family doc in Ohio, and this seems like an interesting concept. So how can this technology? How could I utilize some of this technology?
Well, telemedicine is quite simply the ability of technology to bring that talent to the right place at the right time. So as a family practitioner, you may yourself know that your time is very valuable to make good, efficient use of your time and to be able to reach out and touch the patient, perhaps in the home setting, perhaps in a school setting or a workplace setting, to be able to allow you as a medical professional to assess that patient within the confines of their daily living. So for asthmatic patients, maybe it's seeing their living conditions instead of the sterile environment that you offer in your office. For that cardiac patient, for that high-risk pregnancy, for example, maybe it's a referral to a neonatologist or a genetic specialist to help guide a protocol, assist you as a medical professional, but assist the patient, to allow you to assist the patient in a very timely and effective manner, and bringing really healthcare full circle and allowing you as the primary care to hear and understand what the specialist is advising about your patient.
Mm-hmm. Mm-hmm. So if I'm at home and I want to communicate with the hospital using this teleconferencing thing, so what I need the software on my system and the hospital system, how does that kind of work?
Well, we see video emerging as really a life-changing type of communication and being able to, again, bring immediacy to the situation. So there are many mechanisms that allow video to take place. We need to understand that in the healthcare setting, we're constrained by privacy, concerns about privacy, rightfully so, and the ability to route traffic. Certainly, you don't want to be out there for anybody to call you, but for your specific video at that specific time, it's a key and valuable type technology. We see the process evolving that allows the home care patient, the homebound patient, to be able to check in through video routing, through streamlining of video services, and allowing you as a medical professional to treat that patient in the virtual way very much like they were sitting in one of your examining rooms. So your virtual office environment might be a bunch of video nodes, if you will, that allow you to, again, visit that patient in their environment at that specific time.
And you brought up privacy. One of the things that we get questions on, especially with things like email and things, as far as a password protected type of experience or interaction. How do you guys address privacy?
Well, the technology it does allow for very high level encryption of the video and audio streams. It allows for authentication to allow you as a medical professional to log on very much like you would in a clinical setting to the electronic health record. You log on to the video network, and now you are routed and see the patients that are available for you. Again, we see this video technology enabling an IP telephony type process, where if I'm a video user, a consumer at home, let's say, I pick up my handpiece, my phone is now enabled as a video unit, and I can now transmit real-time interaction for some of the key benchmarks that medical professionals will use to assess the patient.
So do you guys integrate it? Does a product integrate at all with the electronic health record products? And if they do you guys kind of do an interface, or are there interfaces out there to do that?
Well, indeed there are. We see eHealth evolving that will take all the components of electronic healthcare, whether it be the electronic medical record, whether it be the PACS, the X-ray system, or whether it be the interactive component of the examination, and being able to integrate those and present those to the medical professional in a seamless fashion is indeed an extremely powerful tool, enabling tool